Hi, my name's Rahat Hossain. I'm a resident physician in the Department of Psychiatry at the University of Toronto. And I'm somebody who's been really interested in issues of health justice and health equity for a long time. This really started out from my own experiences growing up in really challenging environments. I think moving 7 times by the first 19, 20 years of my life and really struggling through that housing insecurity for a long time. And it left a really lasting impact on me. When I was fortunate to be able to actually go to medical school and start to kind of move past those experiences, I actually decided to bring them with me. And in medical school, the first thing I did was start to focus on issues of homelessness and access to healthcare. And the project that myself and some close friends came up with, we called it HEART, Health and Equity Through Advocacy, Research, and Theater. Long name, but the basic idea was we went to people experiencing homelessness and asked them to tell us their stories about trying to access healthcare, about mental health, even about issues such as suicide and substance use. Then we took their stories, worked with them to create a theater performance, participatory theater, where we actually invited them to come back on stage and share their stories in their words on top of our interpretation, and to share that with politicians, with healthcare providers, with students. And that's exactly what they did back in November 2016. And we took their stories and their goals that came out of that. What they wanted was to be received warmly in the emergency department, to have an advocate there, to have somebody there who can help support them when they need it most. We took those ideas and we, again, worked with the community in the Niagara region, where I went to medical school, and we came up with another program, with another acronym called Niagara Helps, Homelessness Emergency Liaison and Peer Support. The HELPS program was launched in the middle of the pandemic, but continues to this day, almost 2 years later. It provides peer support navigators with lived experience of homelessness in Niagara emergency departments who are there even now, as I record this video, to provide wraparound care, compassion, and advocacy for people experiencing homelessness who come into the emergency department, whatever their needs. And they continue to connect on stories. They connect by bringing forward their story of self, who they are, and making that the bond with the people that they help. And they have been able to help so much, getting people into further care, connecting people to shelters, helping people with substances, helping them feel like they can share more easily what their needs are with their physicians and medical team. So I think I've kind of been able to experience firsthand the power of stories. It's been a central part of the work that I've done. It continues to be a central part even as a clinician, as a psychiatrist, as somebody who tries to connect with people, not just about their problems, but about who they actually are. And I'd encourage you to take full advantage of this training. Honestly, it's beyond powerful.